The following segment is sponsored by OAKVIEW Medical Associates.
September is National Childhood Obesity Awareness Month, and the journey to lifelong good health begins at home. Dr. Nita Bajor is here from OAKVIEW Medical Associates, along with Bonnie PAPAJOHN, the health coach there. Good morning to you both.
Morning. Good morning.
The CDC says 1 in 5 American children has obesity. Talk to us about that trend, Dr. Nita, and what are some of the negative impacts that come with childhood obesity?
Yes, so we know that children who have who are either overweight or who have obesity are at a much higher risk of medical conditions like high blood pressure, diabetes, heart disease, asthma, sleep apnea, and bone and joint problems too. So as they grow up, we do see a very strong link between childhood obesity and adult health. And also on the psychological front, children who have more obesity are prone to more social isolation, depression, poor self-esteem as well.
Right, and obesity has so many contributing factors. There's not one just simple solution, but you're going to walk us through 5 things we can do at home to prevent childhood obesity or turn it around. The first tip, Bonnie, you say eat the rainbow. What do we need to know there?
Right. So when you think about eating the rainbow, you think about eating foods that have a lot of color in them, vegetables, fruits. They're full of phytonutrients and really healthy things that help children grow and get strong. So that's really important for parents to take the initiative to feed their kids the rainbow.
And also, Bonnie, another big thing we can do at home to prevent childhood obesity is move more. How do we encourage more movement?
Well, naturally, if you look at a child run on a playground, naturally they run. That's just what they do. They were born to move. And so we need to encourage that movement with kids. It's innate within them to want to do it. So when they come home from school, have that snack, encourage some playtime so they can have some downtime from their day. They need about 60 minutes a day for a physical activity for children. And you can get that from joining a sports team or riding your bike or playing soccer in the backyard or shoot baskets. So there's lots of different ways that kids can get out there and just simply move.
And Dr. Nita, we've talked about the alarming increase we're seeing in our sugar intake. So the next tip for preventing childhood obesity is slow down on sugar. What's your advice there?
My advice there would be for us to, offer non-sugary drinks first. So give them water first. Also fresh juice. So if you have the opportunity to actually blend the fruits together and give them fresh whole juice, and just lower the content, or avoid sodas. One thing I do at home is I just blend fruits together and I make little ice cubes. I freeze them in an ice cube tray, and then I pop a few of them in their water bottle, and that just is very refreshing, very fresh, and they enjoy that as well.
I like that tip very much. And then we move to screen time, another big issue associated with our increasing childhood obesity rate. So the next tip is reduce screen time. What's your recommendation there?
So you really got to be aware of what your kids are doing, what they're watching, and really limit that time, because that frees up more family time. And, maybe with board games, encourage them to read a book together with the family, mealtime, and just making simple rules like no electronics in the bedroom, just encouraging, time away from the screen, whatever way you can, all adds up.
And that leads us right into sleep, because sleeping well has a big impact on obesity too. Your tip number 5, make sure they're sleeping well. So how do we make sure kids are sleeping well?
One thing I think as parents we can do is to really set the time, set the schedule. So, if it's 8 o'clock, whatever it is, they have to, that way they will plan their evening and be done with all their activities by then. Another one is to just encourage healthy sleep hygiene habits. So it could be just winding down, no extra physical activity or screen time in the evening, no foods that can get them all revved up and hyper, no caffeine, no caffeinated sodas, and just encouraging a good sleep time routine, maybe reading a few pages of a book or just listening to soft music. Well, that's what we call sleep hygiene. And if you encourage that daily, within a few months, you'll notice that the child is sleeping better, their grades are improving in school, they have more attention span, they have more energy during the day. And they actually, because they do that, they sleep better at night too.
Absolutely. There are a lot of great ways to be proactive then. We love to hear that. OAKVIEW Medical Associates is located at 11 Five Forks Plaza Court in Simpsonville, the number 627-0444. Dr. Nita Bajor and Bonnie PAPAJOHN from OAKVIEW Medical Associates, thank you so much for the conversation. Thanks for being here.
You're welcome.
Thank you.